Hello everyone, I am Dr. Mohammad Khalil from Pakistan and I am second year resident of physical medicine and rehabilitation. Today I will be interviewing Professor Antonio Coimbra regarding his keynote lecture in upcoming ISPRM Congress in Portugal. Professor Coimbra received his BSc and PhD degrees in electrical engineering from University of Coimbra, Portugal, and he has been an assistant professor in the Department of Electrical and Computer Engineering of University of Coimbra since 1996. He is a researcher in the ISR Institute of Systems and Robotics of the University of Coimbra. His present research interests include electromagnetic and thermal analysis, electromagnetic compatibility, biped robotics, hyper-redundant robotics, and region-based robotic navigation. He has published over 120 papers in the international conferences and about 35 papers on scientific journals. And we are lucky to have him as a key speaker at our upcoming conference. Welcome, Professor Coimbra. How are you?
Fine, thank you. Hello, everybody.
Yes. So, Professor Coimbra, I would actually like to ask from you that what fascinates you about Portugal and specifically about Lisbon?
Well, Portugal is an European country, the most Western European country. The weather is good, the country is safe, and there are a lot of different landscapes, mountains and flatlands, and everything is very close because Portugal is a small country. So it's usually very pleasant to go around here. And Lisbon is an European capital with old monuments, modern monuments, lots of museums. There is the Tagus River, which is very large in front of Lisbon, about 10 kilometers wide. So it's like a big lake over there, with lots of boats coming in and out the river. And there are two iconic bridges. One is about 10 kilometers long. The other one is like the Golden Gate in San Francisco. So there are lots of things to do and appreciate. The food is good, at least people usually likes it. And so I think everybody will be very pleased to come to Lisbon and to Portugal.
Okay, so Professor Coimbra, we have wonderful keynote lectures in our upcoming ISPRM Congress, and of course you are one of them. So is there any other special keynote lecture that you are looking forward to?
Well, honestly, I've looked into the program, and they all look great. Some from the engineering side, and the others more about medicine and rehabilitation. So I think it will be a very broad presentation on several subjects, and I think they will interest everybody. Myself, I'm wondering about the big data issue, because it's something that is with the artificial intelligence and the role of computers in our life and in our decisions. So it's always something very interesting to listen to. We have another one about regenerative medicine, which is always good to hear about. Technology in rehabilitation, and even these two about the leadership and the future of rehabilitation. It's always nice to hear what other people has to say about these issues. So I think it's a very good choice of keynote lectures, and they will interest a lot of people.
Professor Coimbra, your keynote lecture is scheduled for 4th of July. So can you briefly describe what will be your keynote lecture is going to be about?
So my keynote lecture will be about smart instrumentation for walking rehabilitation assessment. and the role of electrical engineering and robotics on rehabilitation. That's the main subject. So we will go through some pathology diagnosis assisting with the electronics and software, assessment of recovery after surgery or after a stroke, namely the quantification of the evolution of specific variables and values like maximum rotation angles, angular speeds, and those kind of variables that are interesting to assess the evolution after a surgery or after a stroke, so the evolution of rehabilitation. Also about automatic adaptive reference curves for some physical characteristics of patients. So a patient can have a specific characteristic curve, and not a generic characteristic curve. So we can assess in a more precise way the evolution and the quantification of a patient status. We will talk about instrumented insoles, instrumented knee pads to measure variables, force platforms, balance exercises, serious games for rehabilitation and balance improvement, for instance. So this kind of issues involving electrical engineering instrumentation and a little bit of robotics.
Yeah, I think it's going to be a very interesting keynote lecture, especially the role of gains in rehabilitation, and then the use of AI in the diagnosis as well, which we have just touched upon. So I just wanted to ask you another question, that what future do you see for biped and hyper-redundant robots in rehabilitation?
I would say that I would expect more compliant robots, that is robots where the control feedback loop is with force control instead of position control, which is the normal robotics for instance, for precise positioning. Because when leading with persons, we need to be careful about the force that we apply. So I think that compliant robotics will be very important in the future of the use of robotics in rehabilitation. We may expect special sensor instruments and special robotic arms and manipulators to help the therapy process, and namely to have one therapist to monitor several patients at the same time with the help of some technology. So, and maybe in some extent to have people have their own robotic systems or instrumented systems at home in order to keep doing rehabilitation for more time during the day. So I would expect that to happen in the near future, and in some extent it is already happening. So we have already these kind of applications, and they are increasing in number and appearance.
Yeah, I think the future is very bright for the robotics in rehabilitation, you know.